Can you talk about the vaccination program that you've been doing and how is that going and what are your plans to ramp that up?
All right. So when these 3 vaccines came online, Moderna, Pfizer, and Johnson & Johnson, we were promised that the federal government would, with the new president, start overseeing some of these programs and then kick it down to the governors, and the governors would kick it down to the counties, and then we would eventually start immunizing all of our residents. Well, as you know, it hasn't worked out the way it's been planned. And although there's an assurance that we'll have enough vaccines in June to vaccinate every American, having the vaccine itself and getting the vaccines into people's arms are 2 totally different things. So what we did here in Aurora locally, we said, look, we don't want to wait for any federal government or state government or county government to determine whether or not our residents get vaccinated. I said, we're going to have to take the horns in our own hands. We're going to have to take the ball and run with it. We have to determine our own destiny here. The only way to do that is to get doses of vaccines. I said, well, how do we do that? Well, let's call some of our partners, both our health department partners as well as our private partners, Osco, Drug, Walgreens, whoever might have access to this vaccine and say, look, we're Aurora, we're the 2nd largest city in the state. Why don't you come use some of your vaccine here? You're giving it to people for free anyway. We've got 200,000 people, 100,000 adults. Why don't we set it up and start working out of Aurora? And we were lucky enough to get our first set of vaccines from VNA, which we deployed in the minority community, African-American community first, and then the Latino community, because those are the communities that are underserved with the vaccine. Less than 3% of all the vaccines given in both Kane County and DuPage County, totaling about 250 doses, less than 3% of that is African-American.
And can you explain why African-American and Latinos are being distributed to first?
Okay, so it's not being distributed to first. What it's doing is, so let me back up.
Yeah.
Of the 250 doses that have been given out in DuPage and Kane County, only less than 3% of that is African-American and less than 4% of that is Latino. So this tells me a number of things. 1, access, and 2, hesitancy, meaning they don't trust.
They don't trust the vaccine.
They don't trust the vaccine. And then those that do trust don't have access. So what we had to do is we have to dispel the fear, and make people feel comfortable. So let's have these events. In each event, we're going to vaccinate 750 people. But it's not about those 750 vaccines because that's a small, tiny number. It's about using that as a media press conference to make our community feel comfortable. So we had many of our leaders, 30, 40, 50 of our leaders and their families and everybody that is in the know come up and take these vaccines so they can start spreading the word throughout the community that these vaccines are safe. There should be no hesitancy. That's the purpose of those, not to vaccinate, the African or Latino community first, but to make them feel comfortable so they get vaccinated on the same level as our white counterparts. So now, once our communities feel comfortable taking this, and that was partnerships with the VNA, Visiting Nurse Association, then we have the larger vaccine events. We made a partnership with Osco Drug. They bought 2,400 doses. And guess what? We saw African Americans in line. We saw Latinos in line. We saw white people in line. We saw Asian people in line because there's that comfort level now. You know what I'm saying? And because Aurora is 41% Latino, we got to get a stronger comfort level in the Latino community as well. So our community can see that it's okay to take this vaccine and there's no hesitancy. So
there's an age limit though, right? Age 65?
Well, there's 3 categories where you're able to take this vaccine. It's A, B, and C. So the first one is 65 and older. The second one is based on your occupation, if you are a essential worker. And the third one is if you have a medical condition. So if you fall into any of those categories set by the state, that's not set by me, it's set by the state and the state. If you fall into one of those categories, then you can come take it. You could be 22 years old, and if you're an essential worker, you could take it. Or you could be 22 years old, and if you have a medical condition, you can take it. If that falls in the category.
Just go get in line.
Well, no. You have to sign up for it because we have 200,000 people, 100,000 adults. We don't have enough for everybody yet. So we plan on doing these mass Aurora events every week.